If you heard an ominous clanking noise coming from your car engine while driving down the highway, would you just turn up the volume on the radio so you couldn't hear it anymore? Of course you wouldn't. You'd head straight to a mechanic. That brilliant analogy is from Dr. Michael Eades out of his fantastic newsletter, The Arrow. Dr. Eades got an engineering degree before he became an MD, so he looks at the human body like a masterfully built machine. And his point is dead on. Every single day, millions of people do the exact same thing with their health. They get a high cholesterol score or an elevated Apo-B lab result, and instead of asking why the engine is making noise, they take a drug to forcefully drown out the number. They turn up the radio. But those particles aren't an accidental design flaw. Your liver makes them on purpose. When your metabolism goes south, often from chronic carbohydrate overload and stubborn belly fat, the liver goes completely deaf to insulin's slow down signal. It starts pumping out extra delivery trucks because it thinks your tissues are starving for cholesterol. Blasting those trucks out of your bloodstream with a prescription might quiet your lab report, but it leaves the real metabolic fire burning under the hood. And honestly, that's the part standard medicine is completely missing. To really understand why the engine is misfiring, you have to look at how this factory actually handles those delivery trucks. Think of ApoB and LDL as transport vehicles. Their job is to carry vital energy and nutrients from your liver out to the cells that need them. Cholesterol isn't poison, it's a vital building block for your hormones and cell walls. Normally, your liver has little recycling magnets on its surface. When a delivery truck finishes its route, the magnet grabs it and pulls it back into the liver to be recycled. But the liver also produces a little saboteur protein called PCSK9. Think of this protein as a factory worker whose job is to smash those recycling magnets. Why would the liver intentionally smash its own magnets? Because your body's tissues are calling out, hey, we need more supplies down here. Stop pulling the delivery trucks back into the warehouse. It's a beautifully tuned system. But conventional medicine's answer to a high lab number is to throw massive blocks of drugs at it, like statins or those incredibly expensive new monthly shots to stop the magnets from being broken. Suddenly, the liver vacuums every single truck out of the bloodstream. The numbers look perfect on paper. But here's the twist most doctors don't even realize. Statins actually cause your liver to produce more of that saboteur protein as a side effect. Your body tries to fight back against the drug to keep delivery trucks in circulation. So what do? We prescribe a second drug to block the side effect of the first one. Now you're taking multiple massive medications just to keep a vacuum cleaner turned on, all while risking side effects like severe muscle pain, brain fog, and a heavily increased risk of type 2 diabetes, especially for women as they age. We are cutting the wires to the smoke detector and calling that a cure. If you want all the tea on this particular issue, it's the subject of tomorrow's video inside the Health Without Risk app. Grab a free 10-day trial. The sign-up link is in the first comment below and in my link tree.